So medication profile. So again, within the start of care, you'll have your medication profile. Um, you'll need to choose the pharmacy like we reviewed. So if I were to start over here, we'll get this. So if I put in CVS, um, you can choose from whichever CVS there is. And then this will build our library as we enter in. So we might have to enter in the pharmacy and the demographics up front, but once we do that, it'll just continue to build in the system. So everything should pre-populate as you move forward. So once you've chosen that, you'll update that. We have to have that for Medicare guidelines for our disaster plan. Allergy profile. Um, then you come down to build your medication profile. So you're going to select medication. The order date, typically you can just put that as the start of care date. And then you'll add the new medication. So if it's new, and you'll see this typically in the discharge orders, they'll give you a medication list and they'll say new, changed, or unchanged, or discontinued. So, for example, I built a few new medications in the patient's chart already. These are post-surgical medications. But if we wanted to do a long-standing medication, let's say lisinopril 10, we'll say 2 tabs. We'll say daily. Let's go twice daily. Okay. No discontinue date, as we know, it's long standing. So we're going to hit save and add an additional medication. And then you start just to build. Again, you can use the discharge med list from the hospital. If the patient's got their own printout at home, you can use that as well. Whatever best suits the need. It's a lot like Devera, where it'll just populate the drug, and we'll say daily, and you just keep on going, so on and so forth, okay? And then you'll build your med profile, okay? If you want to DC a medication, you can do that. So if it was like an antibiotic for a couple weeks, then you could come back in and DC that. Put a discontinue on that. If they're really not taking the medication, you can delete it. So you have that option. If you are going to administer medication, there's your save reminder. Yeah, it's lame. So don't forget to save. Telling you. If you're going to give a medication in the visit, you can actually record the medication, all of that right here as well. If you're not giving medications, then you will skip this section here. Okay. Once you've built your medication profile, you can do a medication reconciliation snapshot. Okay. So that'll give you potential interactions. There are no drug allergy, duplicate therapy. So this is going to be your interaction or duplicate therapy risk report. This should be done on every single med list. So make sure you hit that reconciliation snapshot to come here and see if I've got major interactions. Those are the ones I want to capture in my start of care. And if the doc's not aware of those issues, we want to make him aware through a phone call and then document that. So as you continue through your medication reconciliation, it's going to go through, medication, physician contact regarding medication discrepancies. No, there were none that we noticed. Um, if there was a severe medication interaction, we would, I'm not sure why that appears there. We would explain what that is, blah, 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 blah. Your e-signature is there, the date, and then you could sign that document, okay? So that snapshot reconciliation will go to your miscellaneous tab in your episode manager, okay? And then it will pop you back to your Oasis. So that's the med profile. Little different, but again, it's going to be within your start of care. And once you've built your med profile, don't forget to reconciliate that med profile and see what the issues are, and then go through and speak to those issues, what you did. If you're getting a med list out of the hospital that's been reviewed by a physician and a pharmacist, post-surgical patient, then the doctor pharmacy is aware. So you can speak to that here. If there are major issues, you can say med list was reviewed by physician and pharmacy prior to discharge from hospital. No med changes ordered at this time. Something like that. That way you're speaking to the fact that yes, we know that there might be major interactions. However, pharmacy and physician have both reviewed those, and then we can teach to those interactions and those issues as far as education goes. Make sure to capture in your start of care if these guys need more education on meds. Medicare gives us three separate visits just for medication education. So if you feel like they don't quite grasp how to take their meds, if they need to be alternating between certain meds, then capture that and say, hey, no, they're not quite compliant or fully educated on the medications. They need reinforcement with blah blah blah. And then again, we can assign a visit specifically just for that if we need to. So there you go. That's your med profile.